All right, here we go. What are your Medicare rights? That is what we're going to talk about today. If you are a Medicare beneficiary or becoming one in the future, then you should know some of your Medicare rights so that one, you don't miss out on something, and two, you don't get taken advantage of. While there are lots of rights when it comes to Medicare, today I'm going to cover 20 of them. In the future, I'll be doing one on what rights you don't have. So if you haven't subscribed, please do, because that one may be even more important to watch. Hi, I'm Chris Prang. I'm the Medicare analyst. I'm a licensed agent in 17 states, and I'm based out of Charlottesville, Virginia. Maximizing your Medicare should be important to you, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. If today is your birthday, then a very happy birthday to you. Francis Cardinal Spellman said, "You've heard of the 3 ages of man: youth, age, and you are looking wonderful." Number one right is the right to information. You have the right to clear, accurate, and timely information about Medicare coverage, benefits, and costs. This includes access to the Medicare and You Handbook and online resources. Number two, the right to choose your providers and have access to medically necessary services. You have a guaranteed right to see doctors, specialists, and hospitals to receive the care you need. Original Medicare, you can see any provider in the United States that accepts Medicare. If you're on Medicare Advantage, you have the right to see providers within your plan's network, often without a referral for certain services like women's health. You also have the right to see out-of-network providers for urgent care and emergency services. Number three, emergency care anywhere. You have the right to receive emergency and urgently needed care whenever and wherever you need it within the United States, even if the provider is not in your plan's network if you have Medicare Advantage. Number four, you have right to access emergency services. Medicare covers emergency and urgent care regardless of whether the provider is in your plan's network. You cannot be denied emergency care. Number five, you have the right to privacy. Your medical and personal information is protected under HIPAA and Medicare rules. Providers must keep your records confidential. Number six, you have the right to make informed decisions. You have the right to know all treatment options, risks, and benefits. You can consent to or refuse care. Number seven, you have the right to appeal decisions, something that many people just don't do. You have the right to appeal denied claims or services. This includes requesting a redetermination, a reconsideration, a hearing, and further steps up to federal court if necessary. Number eight, you have the right to receive quality care. Medicare requires that providers meet quality and safety standards. You have the right to complain about substandard care. Number nine, you have the right to notice before denial or change. You must be notified if Medicare or your plan denies coverage or plans to reduce or change your services. This includes the right to a notice of Medicare non-coverage. Number 10, the right to participate in your care. You can be involved in planning your care and making decisions about treatment. You have the right to request a second opinion. You are a partner in your own health care. You have the right to be fully informed of all your treatment options and help create your own treatment plan. You can refuse treatment if you so choose. You can appoint a representative, like a family member, to make decisions if you become unable to do so. Number 11, the right to protection against discrimination. You cannot be discriminated against because of age, disability, race, sex, religion, national origin, or health condition. This includes access to Medicare services and enrollment. Number 12, you have the right to be treated with dignity and respect. No matter how you receive your Medicare benefits, original Medicare or Medicare Advantage, you have the right to be treated with courtesy and respect at all times by all healthcare providers and Medicare representatives. Number 13, information in a language that you understand. You have the right to receive information about your Medicare benefits and health status in a format and language you can understand. This includes access to interpreters or translated materials if English is not your primary language. 14, you have the right to file a grievance. If you are unhappy with the quality of care you receive, such as a long wait time, a rude staff member, or a doctor's office that isn't clean, you have the right to file a grievance, a formal complaint, with your plan or the state's quality improvement organization. Number 15, guaranteed issue rights for Medigap. In certain situations, such as if your current plan leaves Medicare or you move out of your plan service area, you have a guaranteed issue right to buy a Medicare supplement policy. During these windows, insurance companies cannot deny you coverage or charge you more for pre-existing conditions. Number 16, right to information in an understandable way. You have the right to clear explanations about your treatment options, Medicare coverage, costs, and plan details in a language and format that you can understand. 17, the right to get help resolving issues. You can contact the Medicare beneficiary ombudsman at 1-800-MEDICARE or other resources for assistance with complaints, appeals, or understanding your rights. And number 18, the right to special election periods. If you have a Medicare Advantage plan or a Part D drug plan, you have the right to change that plan when you move. Moving also gives you a guaranteed issue right to get a Medicare supplement if you have a Medicare Advantage plan. If a declared natural disaster impacted your ability to enroll, then you have an extended period of time to make a choice or change and enroll into a new plan. Number 19, you have the right to terminate your Medicare Advantage plan. Every year during the annual election period, you can do this. If you move outside the plan service area, as noted already, this gives you a guaranteed issue right to get a Medicare supplement. If you believe you were misled about your Medicare Advantage plan and you believe you made the wrong plan choice because of inaccurate or misleading information, including using Plan Finder, call 1-800-MEDICARE and explain your situation. Call center representatives can help you throughout the year with options for making changes. And number 20, you have the right to truth. The truth is out there. Unfortunately, there are numerous entities that intentionally lie to you and mislead you, or are just flat out ignorant to your Medicare options. Those entities could be your friends, a family member, a neighbor, agents, brokers, insurance companies, nonprofits, state agencies, providers, and sometimes Medicare itself. My first and best advice is avoid the big e-brokers by not calling some silly 800 number ad that you see on TV or social media promoting purely Medicare Advantage plans. If you hear things like extra benefits, money back on your Social Security check, transportation, zero premium, grocery card, etc., then that's a sign to ignore them. These e-brokers push Medicare Advantage. 90% plus of what they sell are Medicare Advantage plans, while on average only 50% of people get a Medicare Advantage plan. I would also be careful of agents and brokers that totally poo-poo Medicare Advantage and push Medicare supplements only. That's not taking into account your personal needs, philosophies, and budget. And it violates their fiduciary responsibility to let you know of all your Medicare options. And do your due diligence and do some research. Get the Medicare U-Book and start reading through it. Well, that's it for today. I hope that you found this helpful. If you have any questions about what I've just gone over and when you're ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice, again, when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see right here, then please feel free to reach out to me either by phone or through my contact form on my website. You can also schedule an appointment with me or ask me to call you. We will have an open and honest conversation about your healthcare needs, philosophies, and budget, and I will do my best to answer any questions or concerns that you may have. And once we determine what's best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course be available down the road for your support. To stay up to date and gain more insight on maximizing your Medicare insurance and perhaps your health, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prying, the Medicare analyst. Make it a great day.